Cognistat is a rapid, reliable, and affordable cognitive screening tool that quickly assesses cognitive functioning in 5 major ability areas, such as language, construction, memory, calculation, and reasoning, and 3 general cognitive impairment areas, such as level of consciousness, orientation, and attention. It provides an independent assessment of each of the cognitive domains that was assessed, and it can be administered by trained healthcare professionals such as nurses, speech pathologists, occupational therapists, and medical technicians. It is a rapid tool which takes about 15 to 20 minutes to administer. And that is because we have a different approach, which we call the screen and the metric approach. Each section begins with a short but demanding question of a particular ability area, which we call the screen. If the patient has no difficulties answering the question, we move on to the next section. However, if the patient is not able to answer, then the metric is administered, and that is to quantify the degree of the disability. At the end of the test, a graphic profile is generated to display the patient's abilities, disabilities, and the severity of the impairment. We have more than 400 peer-reviewed scientific articles describing Cognistat's use in mild cognitive impairment, dementia, traumatic brain injury, depression, substance abuse, and many others. It also allows you to do longitudinal analysis by allowing the monitoring of the patients in time to compare the progress or the decline so you can provide targeted treatment. And it provides reference profiles. The shaded areas that you can see here are gathered based on the norms that we have. So you can actually compare your patient with those reference profiles. And there is also an MCI index, which will give you the likelihood and a risk assessment for mild cognitive impairment, delirium, or dementia from levels 0 with no indication of cognitive impairment all the way to level 6 that strongly suggests a dementia syndrome. Cognistat avoids global scoring and it provides you a domain-specific degree of impairment. The problem with global scoring is that you can know that there is a presence of impairment. However, you're not able to know exactly where the problem is. While Cognistat will indicate every single area of the brain that is tested, if there is impairment and the degree of impairment. And it also allows you to do a baselining to monitor the cognitive fitness by doing an annual wellness checkup, and then also to monitor the progress or the decline of the patient at a later time. There are certain factors that can have an impact on test results, and Cognistat is able to identify and provide you a potential opportunity for intervention. Additionally, there are certain medications that the patient may be taking, and that may have an impact on the test results. Again, Cognistat will guide you, informing you what are the potential impact to the test performance. It is a great tool for new method of early detection, and it is culturally adapted with clinical validity in several languages, such as English, French, Arabic, Spanish, Greek, Bahasa, Chinese, and others. Cognitive decline needs to be evaluated on a regular basis. For that reason, baseline testing with routine follow-up is the ideal approach, and Cognistat provides the ability for testing and routine retesting patients to compare and highlight any changes. The Cognistat profile allows easy comparison of follow-up testing versus the baseline recovery or decline. Thank you for your time and your attention. If you'd like to have more information, please do not hesitate to contact me at the phone number above or the email that you can see on the screen. Thank you and have a great day.